One of the hardest conversations I ever had began with a wife quietly saying, in my office, with her husband sitting right beside her, "Doctor, he kept telling me he was just tired." He wasn't embarrassed to talk about intimacy. He was embarrassed to admit how different his body suddenly felt. And that's something I hear far more often than people realize. My name is Dr. Alan Mercer. I've spent more than 35 years as a family physician, and in that time, I've sat across from thousands of men and women in their 60s, 70s, and 80s. And one topic keeps coming up, quietly, hesitantly, usually near the end of an appointment when a patient almost forgets to mention it. That topic is what happens in their body during or right after intimacy with a partner. I want to be very clear about something before we go any further. This video is not about performance. It's not about romance advice. It is a medical conversation, the kind I have in my exam room, about a simple fact that many people don't think about. Physical intimacy is a form of physical activity. It raises your heart rate, it raises your blood pressure, it asks something of your heart, your lungs, and your blood vessels in much the same way that climbing a flight of stairs or carrying groceries does. And because of that, sometimes intimacy is the moment when an existing health condition, one that may have been quietly developing for years, finally makes itself known. Most of what I'm about to describe is harmless. Most of it is a normal part of aging or something easily explained by medication, stress, or simple deconditioning. But a smaller number of these symptoms are the body's way of raising a hand and asking for help. My goal today is to help you tell the difference, calmly and clearly, so you know when to simply mention something at your next checkup, and when you should never wait. And I'll tell you now, the last warning sign we'll cover today is the one I and physicians everywhere never advise anyone to ignore, because it may call for emergency care right away. So let's walk through this together, one symptom at a time. Chest pressure or chest pain. Let's start with the one most people worry about most, discomfort in the chest. Some tightness or heaviness during physical exertion, including intimacy, can happen for very ordinary reasons. It might be mild muscle strain from an awkward position. It could be acid reflux, which many older adults experience more often than they realize, especially after a meal. It can even be simple anxiety, because for some people, this kind of closeness brings on nervousness, and nervousness alone can cause a fluttering, tight feeling in the chest. But chest pressure during physical exertion is also one of the classic ways the heart tells us it isn't getting enough blood flow. This is often described as a squeezing, pressing, or heavy sensation, sometimes compared to a weight sitting on the chest. It deserves medical evaluation, especially if it happens more than once, or if it happens with any of the other symptoms we'll talk about today. I think of Robert, a 71-year-old retired mail carrier. He mentioned to me, almost as an afterthought, that he'd felt a strange tightness in his chest a few times over the past month, always during intimacy with his wife, always fading within a few minutes. He nearly didn't bring it up at all. When we ran some basic testing, we found a narrowing in one of the arteries feeding his heart. Only his physician can determine the cause of a symptom like this, and in Robert's case, early treatment made all the difference. He's doing very well today. Sudden, severe shortness of breath. Some breathlessness during physical activity is completely expected. Your body needs more oxygen when your heart rate rises, so a bit of quicker breathing is normal, especially if you're not used to being very active. What's different is a sudden, severe shortness of breath, the kind where you feel like you truly cannot catch your breath, even after resting for a minute or two. This can sometimes be associated with the heart struggling to pump effectively, or with fluid beginning to back up into the lungs, a condition physicians refer to as heart failure. It can also be tied to lung conditions like COPD or asthma flaring up under exertion. Helen, a 68-year-old grandmother of 4, told me she'd started needing to stop and sit down, gasping, during moments of intimacy with her husband. She assumed it was simply being out of shape. When we listened to her lungs and ran some imaging, we found early signs of fluid buildup around her heart. What physicians usually evaluate in a case like this includes listening to the heart and lungs, checking oxygen levels, and sometimes ordering an echocardiogram, which is a painless ultrasound of the heart. Helen's treatment plan has her feeling like herself again. Dizziness or fainting. A little lightheadedness when you sit up or stand quickly is common as we age, often related to blood pressure adjusting more slowly than it used to. That alone usually isn't cause for alarm. But dizziness, or more seriously, actually fainting during or right after intimacy, is different. This can sometimes be associated with a sudden drop in blood pressure, an irregular heart rhythm, or in some cases, a narrowing of one of the heart valves. It deserves medical evaluation, particularly if it happens more than once. Walter, a 74-year-old retired school teacher, actually fainted briefly one evening. He and his wife were frightened, and rightly so. When he came to see me, we discovered he had a heart valve that had narrowed over the years, a very common condition called aortic stenosis. This is exactly the kind of finding that only a physician can uncover, often through a simple listening exam followed by an echocardiogram. Walter is now being carefully monitored, and he continues to enjoy an active, full life with his wife. Heart racing or irregular heartbeat. Your heart rate is supposed to climb during physical activity. That's completely normal and healthy. What's worth paying attention to is a heartbeat that feels wildly irregular, that flutters, skips, or pounds in a way that feels distinctly different from your usual experience, especially if it lingers well after you've rested. This can sometimes be associated with a common condition called atrial fibrillation, where the heart's upper chambers beat out of rhythm. It can also simply be extra heartbeats, called premature contractions, which are usually harmless but still worth mentioning to your physician. Frank, a 66-year-old former truck driver, described his heart flip-flopping for several minutes afterward, something that hadn't happened before. A simple heart monitor worn for a week caught the irregular rhythm in action. What tests might be considered in this situation typically include an EKG and sometimes an extended heart monitor. Frank's condition is now well managed with medication, and he was relieved to learn it wasn't something that meant he had to give up being close with his wife. Pain that spreads into the jaw, shoulder, or left arm. Now here's something that surprised many of my patients over the years, and it surprised one man in particular in a way I'll never forget. Pain doesn't always stay in the chest. Sometimes it travels into the jaw, the neck, the shoulder blades, or down the left arm. Occasionally, it shows up in the upper stomach and gets mistaken for indigestion. This kind of spreading pain, especially when it happens during physical exertion, can sometimes be associated with reduced blood flow to the heart muscle. It's one of the more classic warning signs of a heart attack, and it deserves prompt medical evaluation. James, a 69-year-old retired firefighter, felt what he described as a dull ache moving from his chest into his jaw during intimacy with his wife. He nearly laughed it off as a strange muscle cramp, joking that he must have slept wrong, until it happened again 2 days later, more intense, lasting longer. That time, his wife insisted he go to the emergency room. It turned out he was having a heart attack. Because he got there quickly, his outcome was excellent. But it's a powerful reminder that spreading pain is never something to laugh off. Sudden weakness, numbness, or difficulty speaking. This next one is less commonly discussed, but it matters enormously. Sudden weakness on one side of the body, numbness in the face or arm, slurred speech, or sudden confusion. These can sometimes be associated with a stroke, even when they appear during a moment that seems completely unrelated, like intimacy. Physicians use a simple memory tool for this called FAST: face drooping, arm weakness, speech difficulty, time to call emergency services. If any of these symptoms appear suddenly, regardless of what a person was doing beforehand, it is treated as a medical emergency, because with stroke, every single minute matters for preserving brain function. Carol, a 73-year-old retired librarian, noticed her husband's words suddenly became slurred and one side of his smile seemed to droop just minutes after they'd been intimate. She recognized the signs immediately and called for emergency help. Rapid treatment made a tremendous difference in his recovery. Carol later told me that recognizing those warning signs and not waiting likely saved her husband's life. Unusual exhaustion, lasting hours. Afterward. Feeling pleasantly tired afterward is completely normal. What's different is an exhaustion that feels disproportionate, the kind that leaves you needing to lie down for hours, feeling drained in a way that doesn't match the activity itself. This can sometimes be associated with an underlying heart condition, anemia, thyroid imbalance, or simply medication side effects. It deserves a conversation with your physician, particularly if it's a new pattern. Patricia, a 65-year-old retired accountant, described feeling wiped out for the rest of the day after any physical exertion, including intimacy with her husband. Blood work revealed she had developed anemia, a low red blood cell count, which was leaving her body starved for oxygen during any physical effort. Once we identified and treated the underlying cause, her energy returned within weeks. Bleeding, severe pelvic pain, or other unexpected symptoms. Finally, I want to gently mention a category that applies more specifically to certain symptoms some men and women experience: unexpected bleeding, or severe pelvic or abdominal pain during or after intimacy. For women, this can sometimes be associated with normal age-related changes in tissue, but it can also occasionally be linked to conditions that deserve evaluation, including changes in the uterus or cervix. For men, discomfort in this area can sometimes be associated with prostate or urinary tract conditions. In either case, this is not something to feel embarrassed about. Physicians address this kind of concern every single day, with compassion and complete confidentiality. George, a 70-year-old retired engineer, quietly mentioned some unexpected discomfort to me during a routine visit, almost apologizing for bringing it up. What physicians usually evaluate here includes a straightforward exam and sometimes basic imaging. In George's case, it turned out to be a very manageable and common condition. He told me afterward that he wished he'd mentioned it months earlier, instead of carrying that worry alone. The warning sign: physicians never advise you to ignore. Now, here is the one I promised you at the beginning of this video, the symptom that stands apart from all the others. Because when it appears, physicians everywhere agree it calls for immediate emergency care. That symptom is any combination of sudden chest pain or pressure, along with shortness of breath, sweating, nausea, or pain spreading into the arm or jaw, especially when it doesn't ease up after a few minutes of rest. This combination can sometimes be associated with a heart attack actively in progress. This is never something to wait out, never something to sleep on, and never something to quietly hope will pass. This is the moment to call emergency services immediately. I share this not to frighten you, but because I've seen, again and again, how quickly proper action changes outcomes. Margaret, a 72-year-old retired nurse herself, recognized this exact combination of symptoms in her husband one evening. Because of her quick thinking and immediate call for help, he received treatment in time. She later told me that everything she'd learned about heart attack symptoms over the years came rushing back to her in that single moment, and it made all the difference. Bringing it all together. So let's step back for a moment. Most of what happens in your body during intimacy, a little breathlessness, a racing heart, mild tiredness afterward, has a perfectly harmless explanation. Your body is simply doing what physical activity asks of it, and that's a normal, healthy part of life at any age. But some symptoms, chest pressure, severe shortness of breath, fainting, an irregular heartbeat that lingers, pain spreading into the jaw or arm, sudden weakness or slurred speech, unusual exhaustion, or unexpected bleeding or pain deserve a conversation with your physician. And the combination of chest pain with sweating, nausea, or spreading pain that doesn't ease up is always an emergency. I also want to leave you with this reassurance. Having a heart condition does not mean the end of intimacy in your life. Quite the opposite. Most people with heart disease, once properly evaluated and treated, are able to safely continue being close with their partner. Your physician can help you understand your own personal risk, and often that conversation brings tremendous relief, not restriction. Please don't let embarrassment keep you silent, the way it kept Robert and Helen and so many of my patients silent for far too long. Your physician has heard it all before, and we are here to help you feel your best, safely, for as many years as possible. I'm Dr. Alan Mercer. Thank you for watching. Take good care of yourself, and I'll see you in the next video.